record. I just clicked record. So you guys should see on your screen, it should say medical emergencies. Can anybody not see that? And as always, you should be able to see me and hear me. If this is your first time joining us, sometimes you have to log in and then log back out again because your computer or your laptop will want to download something extra. Probably just because so many people are using this software right now because they're doing their like online teaching, their online courses. If they're not working and they're able to work from home, they are using this software, I guess, a lot to communicate with their coworkers. So a lot of people are using it now. I find even when I log in, like it takes like 20 seconds, whereas before it took like half a second. So it's pretty funny, eh? The world is changing. Okay, so this is definitely a longer PowerPoint. If you guys can notice, it is 88 slides. So usually in our sessions, there's maybe like 20 slides, 30 slides. I'm not expecting us to get through everything, but I just kind of had this all, the extra PowerPoints are for my members. You should see that uploaded in your course now, actually. Because medical emergencies is definitely something that you want to know. But we will be going over through the mock exam questions today. This is a great one for dental hygiene students and dental assisting students equally. So this is a must know, okay? And for those of you guys, again, hello. I see some new members, which is great. As I go through the mock exam questions, if you guys could type your answer in the chat box, that would be wonderful, just so I can see where everybody stands. So who's excited to get started? Hello, so nice to see everybody. Okay, let's go through the first question here. So this is as basic as it gets. So hopefully everybody did study their medical emergencies. So what provides the overall like baseline measurement? Meaning, if you're not sure what that means, like what provides the measurement that you need to have so you kind of know what's normal for your patient? And I will talk about this a little bit afterwards too, because I want to elaborate. So if you guys don't know me yet, even though this is a mock exam questions session, I like to elaborate. So I like to talk about each question and kind of tell you guys what you have to know for the board exam, because it's so much more than just answering questions, isn't it? Yes, exactly. It does help, doesn't it? Now, really read the answer, and I guess read the question to you guys, because 2 answers I would say everybody's picking so far totally makes sense. But what is the question? So what provides the like baseline measurement? Would it be taking vital signs or taking blood pressure? Blood pressure is part of taking vital signs. So blood pressure is more specific, correct? But is this question asking you to be specific? And I'm not going to try to steer you one way or another. I'm just trying to help you guys out a little bit. Okay, the suspense is probably killing you guys. Okay, so you need to take the vital signs. So I did leave notes just so I wouldn't forget to talk about this. So vital signs are so important. Now, blood pressure isn't wrong. So a lot of you guys that said A completely makes sense. But you don't only take the blood pressure. You want to also take, at least for a dental office, you want to take their pulse and check their breathing. Those are considered, at least in a dental office, baseline measurements. I'm thinking after this coronavirus is over, hopefully sooner rather than later, taking temperature will start to become something that they want us to do all the time. So that also falls under the vital signs. In a hospital, obviously you would take temperature on everybody and there's a lot more involved. But I mean, taking a temperature is easy anyway, but I do suspect that that will change for us. So I just left myself a note so I didn't forget. So why do we want to take the blood pressure, the pulse, you know, all of that? Like just as some examples is, if a patient has high or low blood pressure at their new patient exam, you want to take their vital signs at every appointment. Same thing if they had an overly high pulse or a low pulse or their breathing was quite heavy. You want to take the vital signs now at every appointment because that could indicate that something's wrong. Now, our association says, and they kind of changed this though, so I don't see them being this specific for the board exam, but they actually want us to take the vital signs at every appointment. But then in like small writing at the bottom, they say take vital signs for the new patient exam. If it's healthy, then you don't necessarily have to take it every time. But does that mean that we don't take it every time? You know, in the real world, I do not take it every time. I probably should. Even for new patient exams, I tend to forget, and I really shouldn't do that. It's one extra step to have to do, and patients are nervous to begin with, so I don't kind of want to pull out the medical equipment, but we do have to, okay? So does that make sense? So yes, blood pressure is more specific, but as a baseline measurement, we need to take all of it. So the blood pressure, the respiration, and the pulse. They won't ask you to take temperature on the board exam because as of now, that's not considered a baseline measurement. So did everybody hear me? They won't ask you to take temperature on the board exam. That's not considered a baseline. In 6 months, who knows, that might change. Everybody's good? Okay, so we don't have to go through this, but this is just some extra stuff. But okay, what pulse rate is 100 to 160 appropriate for? Meaning if you were taking somebody's pulse and you saw this range, you wouldn't be worried. So appropriate just basically means you wouldn't be worried. It would be okay to have that high number, if that makes sense. Oops, sorry guys, I just changed my screen here. There we go. Can everybody still see the mock exam question screen? Because I just quickly transferred some stuff over. And just a quick note, for those of you guys who are members and are trying to get into the Students of Dentalelle Tutoring group, make sure to send me a message and tell me that you are a member, because I get a lot of people every day that are trying to come in, but it is for members only. So I might actually miss a member who should be in there, but I'm just sort of deleting all of the, I guess, member requests that don't leave me a message, because that's just easier. So please, please, please send me a message if you are a member and you're trying to get in, because that's where I keep all of the session recordings. So you want to obviously see those, right? So please, if you are a member, send me a message. Or when it does ask you, like when you try to, what's the term? When you try to join the private group, it will ask you questions. So just simply say, yes, hi, I am a member, and then give me either your full name or your email that you use to sign up, because people's names that they use to sign up and their name on Facebook is different sometimes. So I just assume that you're not a member if I try to look you up and I can't find you. Just a little side note. Okay, so again, 2 different answers here, you guys, but they were on the right track. So A is the right answer. Now, yes, you would not be taking pulse on a baby anyway, but they want you to know this, because obviously if you picked the answer as an adult or an elderly patient who you would be taking the blood pressure, or sorry, the pulse on, that would be way too high. And if you thought that was appropriate, that would be wrong and they would be concerned, you know, like that kind of thing, right? So is everybody okay with that? And if you didn't know, now you do, so it's perfect. Okay, we don't need to go through that, you guys. Okay, this is good. What is considered normal blood pressure? What do you guys think? I'm gonna wait on, sorry, one more person because I know that you want to answer. So I'm thinking that you're just thinking about it still because I have two different answers here. And this one's tricky because it kind of depends on the textbook actually. Textbooks are different. Okay, so two, oh, I'm actually surprised at some of these. So yeah, there's two different answers, but yeah, okay. So you guys, so C is the best answer. A lot of you guys actually said the last one, which is interesting. Is that something that you had learned in school? Because that is definitely wrong. It's not bad blood pressure, but that would be considered on the low side. Like that would probably be my blood pressure. Like, but I have low blood pressure though. Unless I'm at the doctor's office, that it goes high. But normal is like 120 over 80, like 125 over 85. It does depend on the textbook. Even in my opinion, like 129 over 90 is normal too. Like in the real world, I would not be concerned. But the main things to know is that A is not correct. That's not normal. And the last one would be too low. And yes, exactly. Like it depends on the textbook you read. And that's the thing. They change it all the time. On the board exam, they're not concerned with the newest, I guess, guidelines, which is silly. You would think that they would be. But the good news is, I think they have stopped asking this question on the board exam because the guidelines change like every 2 months. They truly, truly do. Even if you guys look at like the Heart and Stroke website, it changes because it just always changes. So technically, yes, absolutely. For the new guidelines, 120 over 80 is considered pre-hypertensive, which is ridiculous. I'm sorry, that's ridiculous. How could that be normal 5 years ago and now it's considered pre-hypertensive? Like, give me a break. So I know, weird, right? But for the board exam, you guys, they still want you to know basically anything under 130 is considered normal as long as it's like over like 115. But for the board exam, don't worry too much, but I did want to have this slide to talk about it. I guess in your minds, think 120 over 80 is normal. A little bit below is fine, a little bit above is fine, but just know if it's like 150, then that's too high. If it's like 110, okay, that's getting to be low. Because yes, I definitely wanted to talk about this, so I didn't forget. I know. It's weird. You would think that they would just make things easier, right? Okay, guys, this is a good one. They ask this a lot, I find, on the dental assisting exam, not so much the hygiene exam, but what color is the nitrous cylinder? And you guys are fast today. That's awesome. So that tells me you know your stuff. And some of you guys are not students of mine. So you guys are good because if you were a student of mine, we just had a medical emergency session like what, a month or two ago. So I would expect everybody to know this because we talked about it probably for like 20 minutes. You guys are awesome. I think everybody has the same answer. Good to know. So yes, you guys, it's blue. And I just kind of left a little note for you. Now, they don't usually ask about these other ones. So that's why I didn't like highlight them in a different color, but you never know. I really don't think though that they would ask about these, but just so you know, there are different colors for different things. Of course, oxygen is green. A lot of people think that oxygen would be blue because you just think oxygen blue kind of makes sense to me. But no, oxygen is considered green. Okay, very good, you guys. Okay, a level of altered consciousness that may lead to loss of consciousness. What is this? I should put that in. Oops. What is this? Oh, Lisa, how do you like the toothpaste? She was just letting me know that she had her toothpaste in about 3 days ago. Isn't it awesome? Yes, it's the only one that I use because it actually helps to make your teeth whiter without damaging anything. I love it. Good, I am so happy. And it has a nice like light taste too, doesn't it? Because I don't like things that are like super minty, but I kind of like a little bit of mint in there. So it's kind of like a vanilla mint, I would say. Awesome, good. And take a picture of your teeth now and then take a picture of your teeth in like a week. You will notice a big difference because you drink a lot of tea, I think you were saying, right? Yeah, you're like me. You will notice a huge difference. Okay, guys, so I'm getting two different answers again. I'm getting a lot of C's and a lot of D's. And this is tricky because, you know, you have to know the direct definition, but people don't think to study it because they don't think that they will ask a question like this. So a level of altered consciousness that may lead to loss of consciousness. So what this is asking is, you're conscious, but it's like something's not right, and then it could lead to you becoming unconscious. All of these kind of sound right, don't they? It could happen in any of these actually, but the best answer is C. And they say this because that is a direct definition in the textbook, meaning, and I actually have this too. So what happens is, especially if somebody has lower blood pressure, but it could happen with high too. If you're laying down for a long period of time and then you like all of a sudden get up, so as if you're in a dental chair, always sit the patient up slowly and, you know, say, hey, there's no rush, take your time, because if I get out of the chair too quickly, I can be like, whoa, you know, take your time, no rush, because if they get up too quickly, the blood just hasn't had a chance to get back yet. Like it just hasn't had a chance to move around. So your body just doesn't know what to do and it almost kind of shuts down. Usually they don't go unconscious. Like I've seen it happen where they do try to get up too fast and the patient kind of goes like, oh wow, I'm actually seeing stars right now. Whoa, let me just sit down. And then they're fine. But this is from the textbook. Anything could really lead to that, because if you're having a heart attack, like you won't feel good. You'll be like, okay, whoa, this is weird, and you could pass out. A stroke, the same thing with hypertension. If your blood pressure is too high, this actually could happen too. But in the textbook, you guys, that's what you have to know. So is everybody good with that? And I think I said this before. Yeah, I've said this, but even if you're not a member, if there's a question that you guys are kind of like, whoa, that was really hard, like just take a picture of it. Like take a picture of it on your like cell phone and then make sure to look into that afterwards, okay? Just look in your like textbook, notes, anything. Because any question that you don't get right, you need to look into it further. That's what mock exam questions are for. It's not just simply knowing, okay, do I know the answer, yes or no? But for every answer you get wrong, it means you have to study that further. Okay, so what is this? Attacks of sudden onset during which the patient's airways narrow. And I should say too, if there's a question that you don't understand, please let me know, because I tend to do these mock exam questions late at night and I'm half asleep. So I find sometimes the words don't make sense. So I really have to stop doing that. So please let me know. I know this one's hard, but even if you guys don't know the answer, I say this all the time, just pick something. Take a really good educated guess, because on the board exam, you don't want to leave anything blank. A lot of students tell me they don't have time to actually finish the exam and they leave questions blank. Do not do that. That's the worst thing, because that's automatically wrong, right? Yeah, it's automatically wrong if you leave a question blank. Oh yeah, for sure, because how would that be right? Even if you just pick one, at least you're taking a guess, right? Right? So don't you dare leave anything out. Do not answer something or you're in big trouble. You guys are fast again. This is great. Okay, so it's not as easy as you might have thought, but yes, asthma. A lot of you said hyperventilation. That's not wrong either because it could happen quickly, but it's not about their airway becoming narrow. They just can't catch their breath. Does that make sense? Does that make sense? Yeah? Okay. So again, it's not wrong, but it is wrong because it's not about the patient's, I mean, it is about the patient's airway because they can't get it in like properly, if that makes sense. But they don't actually narrow. With asthma, that's what happens. That's what happens. So that's why it's so serious and they need to have a bronchodilator, which is also referred to as a puffer or a ventilator in some cases. I know. Okay, next one. Abnormal decrease in the glucose level in the blood. So what is that? What's the abnormal decrease in the glucose level of the blood? So this is kind of like a special needs medical emergencies type, which kind of means the same thing anyway, doesn't it? I'm getting a lot of D's and a lot of A's. Actually, a few C's as well. I know, it's kind of tricky, eh? Okay, so D is the best answer. Okay, so I did get a lot of, I would say a lot of A's too. Okay, so abnormal decrease in the glucose level in the blood. So that is asking something specific, isn't it? So you would need to know, okay, something specific would be hypoglycemia. Saying diabetes, yes, that could happen in a diabetic patient, but they could also have too much glucose as well, right? So if you guys were thinking A or D, you would definitely want to be more specific because you could be thinking, okay, if the answer is A, is that the only thing that can happen in diabetes where they get an abnormal decrease in the glucose level? But they could also have too much. So that's why A is not the best answer and D is better because that is what it means. It's a decrease in the glucose level in the blood. Does that help to narrow it down? Yeah? Okay. Next one. Inserting a tube into the trachea as an emergency airway is, so what does that mean? And they have asked this on the board exam before, which is interesting because as dental professionals, we would not do this, thank God. I would not be interested, thank you. I like teeth. I don't want to deal with the other stuff. I know, I can't imagine. Being a nurse is so tough, I really cannot imagine. They're pretty good. I mean, this to me was kind of an easy one, but I did want to have it just because they have asked that on the board exam before, so I didn't not want to ask it in case somebody didn't know. Yeah, exactly. Yes. So to intubate. I think everybody got that right actually, so I don't have to go into it further, but yes, that's exactly what it means. Okay. What is heat exhaustion? They have asked this on the board exam too. Interesting, eh? Because you wouldn't think you would have to know it as a dental professional. Was this an easy one, you guys? Yes, everybody got A, which is perfect. That's pretty much it. That was easy. That was easy. Okay, next one. Well, what is asystole? I think that's how you pronounce it. Asystole. Asystole? Asystole? What is it? Definitely a must know. Another one. You guys are quick. I love this. So yes, absence of a heartbeat. So when this happens, that's not good, as you can imagine. Okay. What results from severe hyperglycemia? Keywords, you guys. Severe hyperglycemia. So what happens when this happens? What do you think? Very good, you guys. Very impressed right now. I think this is probably the best mock exam session that you guys have had, by the way. Awesome. Let's move on. So sweating, also called diaphoresis, because they have asked that on the board exam before and they did not say the word sweating, they had said the diaphoresis. So that's why I put that in there. Nausea or indigestion, cold and clammy skin, general malaise are signs of what? Digestion. Actually, we'll keep it at that. There. So what are signs? Sorry, I'm going to have to make this a little bit smaller. What are signs of all of this? So sweating, nausea, being indigestive, clammy skin, malaise. I know, it's kind of signs of everything, isn't it? Story of healthcare. Story of healthcare, let me tell you. I will give you guys a couple minutes because I see that some of you have question marks. Even if you're not sure, just pick one that you think could be it. I know, this is one that you have to think about. Okay, let's definitely talk about this one. So it is actually C, okay? And they say they have this because they want you to know the signs of a heart attack. I think only 2 people got this right, actually. So if you had picked C, good for you. A lot of you guys said signs of an allergic reaction, and that's the thing. None of these are wrong, to be honest with you, but I'm picking out like the key things, like cold and clammy skin. Okay, yes, that could happen with signs of a flu, but well, yes, it could. But it's specific to a heart attack because the person will be sweating. But they will like feel cold. So they feel hot, but if you touch them, they feel cold. I would say those are the key things there, okay? Because in an allergic reaction, you're not really, well, you could be sweating, I suppose, but that's just not one of the definitions that they give you in a textbook. Signs of a flu, all of that could happen too, but usually not at the same time. It's kind of one or the other. So you know what? I would just say, so this is slide 29. Just know these signs exactly, because that is signs that somebody's having a heart attack. They really want you to know that. Okay, but you guys did pretty well with that. Let's go through the next one here. So cardiac drugs treat arrhythmias and congestive heart failure. So which one would treat both? That's what this question's asking here. Which one would treat both? Good question. Is clammy skin a main sign? Yes, definitely. But of course, having that said, not everybody gets it, but I find like in the textbook, if somebody's like, oh, I just don't feel good, I'm fine. Oh, yeah, I kind of have chest pains, but I'm fine. Like towards the end of you're about to pass out, their skin is very, very clammy. Like, how, I don't know if you guys have ever experienced this, hopefully not, but if you have a patient in your chair that is going through a medical emergency, like every second things get worse. So they're not going to have like clammy skin, let's just say, right away, like not right away. But as it gets worse, that happens. So yes, it's a main sign, but you don't see it right away, if that makes more sense. Kind of like if somebody's about to pass out, they won't feel good, they'll feel kind of funny, and then they'll probably see stars, and then they won't be able to hear because your hearing actually like stops, which is weird. So things get worse. I've had that happen to me a lot, so I definitely know it sucks, but not for a long time, thankfully. Okay, you guys, so C is the best answer. I did leave notes here because I really didn't want to forget, and even I can't memorize all of this, so that's why I left myself notes. I just want to change this to colors that you guys can see better. So if you guys do not have this, definitely take a picture. If you are members, you do have this inside your course. You just have to log in. This is slide 31. So these are the different types of drugs, but this one, C, treats both. Does that make sense? Believe it or not, a lot of you guys did not have C, so I just wanted to make sure that this was okay. But my guess is you just didn't know the different types of drugs and you were picking something, which is great. At least you picked something. Feel free to take a picture of this if you need to. That's no problem. Good, perfect. I just kind of left myself some notes. You guys don't have to worry about those yet. Okay, so talking about like the different signs. So the early signs, the later signs. So an early sign of a medical emergency could be what? And the key word is definitely early sign. That's why I put that there. Yes, of course, anytime. I do not mind if you guys would like to take pictures. But thank you for asking. But yeah, that's absolutely okay by me. An early sign, that is really a key here. And another thing that I want to point out is some of these answers are not signs. It's okay, this is happening. There is a medical emergency happening. So does that help? So it's not asking when is that medical emergency happening? It's the signs and you're trying to prevent one. And I'll talk about that a bit more when you guys know the answer. Like, I'm trying not to give it away for you. I'm not very good at that, but you know. Okay, well, let's talk about it. This was tricky. So pale skin is the best answer. A lot of you guys actually said A or B. Now, A and B is a medical emergency. So if the breathing has stopped, that's not a sign. That is, okay, something's happening. Same thing with B. If the patient's choking, that's not a sign. It's a, I don't know what the word is. It's not a symptom, but it's happening. Like it's like, whoa. C, that's a sign. So it's kind of like, oh, you have pale skin. That's weird. That's a sign. Fainting, something's already happened. I guess if you want to think, if a patient has pale skin, you're not going to panic. If a patient has stopped breathing, you're going to panic. If the patient's choking, you're going to panic. If the patient is starting to faint, you're going to panic. If there's pale skin, you think, okay, what's going on here? But nothing's happened yet. Does that help you guys? Okay, good. Next one. Let's go through. Looking for my questions. Okay, guys, hold on. I'm going to stop sharing my screen. Let's find these questions. Is that all the questions I had? I didn't realize. Whoops. Oh, no, I have more. And that's okay, because we're actually almost done anyway. Time flies when you're having fun. Does anybody have any questions, though, so far I should ask? Ask me questions anytime. Okay, next one. What do you do first if a patient is in respiratory distress? What's the first thing you do? Not the second thing, not the last thing, but the first. What do you guys think? Yep, I will give you another second to think about it. I know it's a thinker for sure. Okay, let's talk about it. So actually, there's a wide variety of answers here. I think there's like A, B, C, and D. Okay, how can I explain this? What do you do first if a patient is in respiratory distress? So I guess if they're having trouble breathing, what do you do? This is a great question actually, because it's a must know. Okay, so let's talk about it. So you want to check for any foreign objects. That's because even if you perform CPR, if there's a foreign object in there, because a lot of people picked B, you have to get that out first. If there's a foreign object in there, you have to do the abdominal thrusts. Because if you don't and you're performing CPR, your air isn't going to get in there. Does that make sense? Call 911 isn't wrong. They always teach you that's the first thing you should do. But in the textbook for the board exam, if the patient is having trouble breathing, first check for any foreign objects, because if you take that time to call 911, that foreign object could be getting deeper and deeper. When if you had just performed the abdominal thrusts, you might not have the need to call 911. Does that make sense? It's always better if there's two people. Like if there was two people, have somebody call 911 just in case, and then somebody else checking for foreign objects. Does that make sense? Like think about it. If you're alone and you can tell that somebody is having trouble breathing, it's probably because they're choking. You would want to, well, you would want to do the abdominal thrusts, you know, but it doesn't say here that you know that they're choking it. It just says that you can tell they're in respiratory distress. It's a tricky one, you guys. It is. Okay, let's see. What other questions do I have for you? That might be it. I thought I had other ones. There we go. This was a long lecture for my members. Yeah, actually that was it, but that's okay because we are done now anyway. So that was pretty good. Does anybody have any questions though about medical emergencies? Definitely study this if you guys were having trouble, but actually a lot of you guys did very, very well, so that was fantastic. Oh yeah, thank you. I am so happy to help. Oh, that's a good question. So somebody's asking, what's the difference between a myocardial infarction, which means heart attack, and the difference between angina? Now, can anybody answer that? Like, I'm just curious what people are thinking. And then, yes, I will definitely answer that for you because there is a big, big difference. So basically, angina is chest pains. It could lead to a heart attack, but it's not a heart attack. It's quite common for after somebody has a heart attack, they are now experiencing angina, where the doctor will likely prescribe the nitroglycerin spray or tablets. So that way, if the patient or the person is getting chest pains a lot, they can take their tablet or spray, and then that should make it feel better. If it doesn't get better though, then the patient's likely having a heart attack. But if it does, then that tells them that they're having angina. So a myocardial infarction is a heart attack. So the same symptoms, they're having chest pains, but it doesn't go away. And just on a personal note, everybody should have aspirin in their house. Like I don't take aspirin, but I have a small thing of aspirin in my house, so that if you ever think you're having a heart attack, taking an aspirin can actually help it not get worse while you're calling 911 or while somebody is calling 911, you know. Oh, yes. Somebody wanted to see question slide 12 and 13. That's a good question too. So talking about the guidelines. They change so often and they don't tell us which ones they want you to know for the board exam. So I just kind of tell you guys, I guess, the more common one, the normal one. What's in your textbook? That's what I tell you guys. So the textbook that you guys have from school, study that, okay? I mean, I told you the answers anyway, but I guess study that. Oh, and I think you wanted to see slide 13 too, right, Madeline? So the 12 and 13. Yes. Yes, I do have the slides. Karen Deep, I think you're a member, like you're a Board Exam Prep Academy member, right? Because I have the slides in the Board Exam Prep Academy. If you're an Express member, you get the recordings. If you're a Board Exam Prep member, you get the PowerPoints and the recordings too. If you're an Express member, the Express, I call it, a Board Exam Prep course, you get the recordings. So as you're going through them, you can take a picture of them if you like. Oh, the new AAP like Perio. Gotta leave myself a note. And if you're having trouble finding that PowerPoint, it will be in your course. But Karen Deep, yeah, I'll have to check your file. Sorry, I can't remember if you're an Express or a like a full Board Exam Prep Academy member, but again, just like you can take as many pictures as you like. I do not mind. Oh, yes. Actually, that's a good one. I do talk about the AAP classification in the Perio lectures. I don't think we've had Perio in a while, so we can definitely do that. How about we do a Perio lecture on Tuesday? Because I just would like to find my files and add to it if I can. Yeah, that's a great one. I don't know what we're doing tomorrow yet, guys. Sorry, I just want to check my files. Okay, yes, I thought so. So yeah, so make sure, I think you're in the Students of Dentalelle Tutoring Facebook group, right? Like make sure you're in there so you can see the recordings. And actually, yes, I will upload this PowerPoint because there's more in it. I will upload this for you guys in the Facebook group too. Okay, so I will add this since I did add like more to it. No problem. Yeah. So thank you for mentioning something. I will definitely do that. Actually, let me see. What can we do tomorrow? Let me look at my files here. Because I was updating some. You guys, have we talked about community in a little bit? I don't think so. How about tomorrow? Because tomorrow's Saturday. Let's talk about community. That will be our session for tomorrow. I don't like doing community because it's just boring. But let's talk about community tomorrow. Oh my God, sorry. Talking about choking. I'm choking on my own saliva. What was I going to say? What was I going to say? Sorry, guys, I totally lost my train of thought. Oh, yes. So tomorrow it will be at 10 a.m. Eastern time. And yes, I don't know. With this whole coronavirus, it looks like we might be staying home for a couple months, huh? That's a good question too. We will be having these tutoring sessions at least until the middle of April. So there are more coming. And yes, if you are a member of the Express board exam prep course, you get all of the sessions, even from 2019. So here, I can leave the links for you guys again. They are, sorry, I'm just gonna stop sharing my screen for a moment. They are on the website at dentalelle.podia.com, but I can copy and paste them for you guys. But while I'm doing that, do you guys have any other questions about anything? I'm very happy to help. I keep thinking I see somebody out there, but it's just the shadows. Yes, community is hard. There, guys, I'm just typing in the chat box the links for the Dental Hygiene Express course and the Dental Assisting. There is a lot in there, like there's PowerPoints, there's more mock exams, there's more case studies. You get to listen to the session recordings from 2018. So there's a lot there. So, and that's really what everybody should be doing because you're at home, but sometimes you might not want to just read a textbook or read notes. Listen to me teaching you. Like imagine just listening even to the session that we did now. You could be doing the dishes and like I could be asking you guys a question. You can be thinking of it even if you're not looking at the screen, thinking about, oh shoot, do I know that answer? And then I give you the answer. So it's perfect. The best way to study is from mock exams, I'm telling you, because then you know what you don't know and you can study more of that. That's a good question too. So somebody's asking me, if you've taken the board exam twice, where do you start studying? Study everything again. That's the best advice also that I can give you too, because I find a lot of students who have taken the board exam and they did not pass, they will only study what they think they didn't know. And then everything else they don't study. And then by the time they take the board exam again, the questions that they didn't know aren't even on it. And it's the questions that they thought that they knew, but they haven't studied it for like 3 months. So they fail again. So study everything. And if you've taken the board exam twice before, I mean, think about it. You don't want to study. You feel like, I don't even know what to study. That's why signing up for a tutoring course is so important, because you can go through the modules and all of the notes are new notes. So yes, it's the same material, but it's new notes and it's explained in a different way. So you're not just reading the same thing over and over and over again. I'm not just saying that because I teach a tutoring course, but because I like, it's just so important. And I find that it does help students so much, and that makes me happy. I know. They keep moving the exam. I get it. I guess it's just because they don't know what's going on. But look at it this way. It means that you don't have to study like 6 hours a day every day. You can study 2 hours a day every day. So you're always, keeping your brain as fresh as possible, and then take a break, take it easy. Because for those of you who, let's just say you were taking the board exam like next month, I would say, okay, like study 6 hours a day, like over and over again. If it's like 2 or 3 months, then that's actually nicer because you can study, say, 2 hours and then do other things. But yes, I do suggest studying every day, but you can take a day where you don't have to do anything. Just take a break. We all need a break sometimes. You are so welcome. My pleasure. Yes, if there's anybody here who did want to sign up for that course, you have full access right away. And you will have access to the private group also, so that you can ask questions, you can talk to other students, form like online studying nights or something, I don't know, it is neat. And you get more, like you get so much more, which is nice. Because studying is boring, studying sucks, but I promise you guys, I can make it more exciting for you, where you're actually learning and you're excited to learn. At least I like to think so. You are so welcome, you guys, anytime. Have a good Friday. Hopefully you guys can get outside. I don't know how it is where you guys live, but it's a high of 12 here today. Not yet, but it will be. So that's really nice. Thank you guys so much. Have a nice day, and I'll see you guys tomorrow at 10 a.m. where we'll be, 10 a.m. Eastern time, where we will be going through community. Thank you guys. Bye for now. Bye.